my name is Lacey Birch. I currently work for Indiana University IU Health Ball Memorial as a registered nurse, and I'm getting ready to graduate from Indiana University East with my BSN. I also obtained my LPN through Ivy Tech and my RN ASN through Ivy Tech as well. I've been an LPN for 2 years, and I have been practicing as an RN for 1 year. My current job title, I am a resource nurse, which also translates to a float nurse. Professionally, I've really grown with starting from the bottom and working as an LPN, an RN, and also transitioning from a hospital with team nursing with an RN and LPN to a teaching hospital that's magnet status with all RNs and primary care only. So transitioning through these different roles and seeing different avenues of healthcare, and especially now working as a resource nurse and floating to different areas of the hospital, have really allowed me to understand different areas of nursing and gather experience and education along the way to help provide better patient education in the role of a provider. Being a provider in the family nurse practitioner role would really help me reach my goals in terms of having more of a one-on-one experience with the patient and being able to provide that holistic care from the approach of the provider and patient relationship in the family practice setting. Seeing that patient over an extended period of time versus one inpatient stay over a couple of days to be able to develop and grow that relationship. So obtaining my family nurse practitioner from Georgetown would really help me reach that goal. Georgetown's mission statement actually very accurately aligns with my goals as well, especially the line, "Live generously in service to others," because as a nurse in the family practice setting, that's exactly what I would be providing in the provider role, as well as that's what I'm currently doing working in a community non-for-profit hospital organization, is just giving that service to others and sharing my knowledge base and my caring attitude towards my patients. The greatest challenges that I will have with obtaining my MSN online is just managing it with life in general. I'm a full-time employee, I'm a mother, I'm a student, I'm a wife. So balancing all of these within my lifestyle, it's always a challenge. But I've been able to cope through all of these years of my education already with the support of a great family and husband, and my daughter provides a lot of motivation, so I don't think it's something that I can't do. It's definitely, I've got more motivation than ever to complete this. I've had a lot of clinical situations over the years that have really prepared me to deal with roles that I didn't anticipate, with trying to communicate between family members, physicians, hospital staff, consults. But the one that stands out the most is when I really had to step up in the leadership role as a newer RN when I was caring for pediatric patients, and I had a pediatric code, which does not happen in the hospital that I worked in. So in that situation, I feel like I exemplified leadership and communication, especially by helping the father understand what was going on and pulling myself back and speaking with the physicians, letting them know everything up until that point. Calling to the consult hospital that we were going to be care flighting them out to, I really had to see it from all angles and communicate and keep that teamwork going so that we could all reach the common goal of helping that child, which luckily 4 or 5 hours later we did. It's difficult in those situations to remain calm and focused and be able to communicate clearly and get your point across, and I felt that I handled that really well. In terms of my life experiences for where I'm headed now, this has always been a goal. This is what I've always said I wanted to do, and I have taken the long way around things, but as a result, I have gained experience along the way. So working as a full-time nurse while going to school with LPN, RN, ASN, BSN, MSN, I feel like I've really been able to get a lot of experience from different areas. I know exactly what every level of care consists of, and I appreciate those people in those roles and functions because I did that position. So having worked and having experience in doing all of these things have really helped me see even more clearly that I do want to work in the role of a provider, and I feel like I have a lot of resources available to me with working all of these areas. Thank you.